Gynecomastia is a problem that affects a lot of men overall, and it's where you have excess breast tissue. And that can be caused from a number of different things, but for a lot of men that I see, they're fit, they have some extra tissue in their breast, and it bothers them. And so you can do gynecomastia surgery, and one of the techniques we do is what's called Scarless Gynecomastia. So through a small little poke incision, we can remove some of that fatty tissue and some of that breast tissue, and we can do it using a device called BodyTite. And the BodyTite dissolves that tissue, and then we liposuction that tissue out, and you'll get some contraction of that tissue. And so there's virtually no scar associated with it. When you do a Scarless Gynecomastia procedure, you have a couple little pokes in the breast. So there's a tiny, tiny scar, and you numb that area up. So you put what's called tumescent solution in there, and then you pass this device through that tissue, and it heats the tissue up in between. And so if there's breast tissue there, it will liquefy that tissue. Once it's liquefied, then we go and use liposuction to remove it. And with the energy that you have from BodyTite, it causes the skin to contract down by about 30 to 35%. You know, the results, we typically tell patients it takes about 3 months to see about 75% of the result and about a year to see a full result. The way we determine whether we have to do a more traditional gynecomastia surgery where we make an incision around the nipple or a much bigger incision, it's really based on the breast size. So if a man has a really large breast, then they're not going to be a candidate for this. And if someone has lost a significant amount of weight, which is very common now with all the GLP-1 agonists like Ozempic or Wegovy, that they're going to have a lot of excess skin, and they wouldn't be a candidate for that. And so in those patients, we typically have to do more of a traditional gynecomastia surgery where they're going to have some scars associated with it. A lot of men who have gynecomastia, they're very self-conscious about it, and they don't want to take their shirt off in public, they don't want to wear a tight shirt, and so it does affect their self-confidence. And so when you do this procedure, the breast is smaller, it's tighter, and they have a whole lot more confidence than they had prior to the procedure. And so I think when you have that, you think you're the only one that has it. There's a lot of men out there that have it, and there's something you can do about it.